Hello and welcome to NHIS in a week. Here we give you highlights and happenings in the authority and beyond. My name is Ifia Trema. Now the headlines. NHIA CEO announces Mahama Care Initiative and free primary health care program. Government reaffirms commitment to universal health care coverage. And NHIA engages World Bank to improve NHIS efficiency. The news in detail. The government has reiterated its commitment to achieving universal health coverage through strategic efforts to strengthen the National Health Insurance Scheme. The Chief Executive of the National Health Insurance Authority, Dr. Victor Asare-Bampoe, made this known at the Cape Coast Teaching Hospital's annual performance review meeting.
The meeting was attended by health facility representatives, traditional leaders, and Ghana Health Service officials. It served as a platform to assess progress and discuss challenges in the health sector. Dr. Bampoe stressed that boosting public confidence in the NHIS remains a key pillar of the government healthcare strategy. However, he acknowledged concerns such as illegal out-of-pocket payments, skepticism about NHIS reliability, and low tariffs.
I'm not oblivious of all the challenges that we have, the lack of confidence in the scheme, the fact that sometimes funding does not come on time, and all the other issues. But I think it's time for us to take things to another level.
Dr. Bampoe assures stakeholders that measures are being taken to address these issues as the NHIA remains committed to achieving universal health care access for all Ghanaians.
As a group, as a partner, we think that at this point and here we can pledge that we will work diligently to be an effective stakeholder to you as providers, to you as consumers, so that ultimately the whole of Ghana will benefit from what we have pledged to do, which is to attain universal health coverage. So I wish you a very successful meeting, and let us know how we can continue to collaborate with you in the future.
Also in the news, at the Cape Coast Teaching Hospital's annual performance review last Thursday, the Chief Executive Officer of the National Health Insurance Authority, Dr. Victor Asare-Bampoe, outlined two key government initiatives aimed at improving healthcare access across Ghana: Mahama Care and free primary healthcare services. Dr. Bampoe said the Mahama Care Initiative, a program designed to assist individuals with chronic diseases such as kidney disease, cancer, diabetes, hypertension, and heart diseases. Through this initiative, the government aims to provide financial support to those who cannot afford expensive treatment and medications.
Dr. Bampoe said in addition to Mahama Care, the government will implement the free primary healthcare services across the country. Mahama Care is a government initiative that will provide financial support for individuals with chronic illnesses to access necessary treatments, while free primary healthcare offers no-cost basic medical services, especially in rural areas, to ensure equitable access to care for all Ghanaians.
As you know, the government already pledged that we're going to be rolling out the Mahama Cares, the Ghana Medical Trust Fund, also deepening and strengthening the primary healthcare, free primary healthcare system to attain universal health coverage.
Both Mahama Care and free primary healthcare will work hand in hand with the National Health Insurance Scheme, helping to create a more inclusive and accessible healthcare system for all.
A surprise visit by NHIA's Chief Executive Officer, Dr. Victor Asare-Bampoe, to the Accra Claims Processing Center has reinforced his commitment to a supportive work environment. During the visit, he engaged with staff, reviewed operational challenges, and reaffirmed executive management's dedication to improving service delivery.
The visit also aligns with the Mahama Cares initiative aimed at expanding healthcare access, particularly for patients with chronic conditions. Dr. Bampoe commended staff for their dedication and assured them of management's commitment to fostering a productive work environment.
The National Health Insurance Authority is intensifying efforts to enhance efficiency in Ghana's National Health Insurance Scheme. A high-level meeting between NHIA leadership and the World Bank focused on key areas for improvement, including financial sustainability and operational reforms.
The discussions also addressed concerns raised by the International Monetary Fund regarding NHI's funding and sustainability. The partnership between NHI and the World Bank remains crucial in securing a robust and sustainable healthcare financing system for Ghana.
Also in the news, the NHIA's Human Resource Directorate is calling on staff to uphold discipline and professionalism in their daily operations. Speaking at the general meeting, the Deputy Director of Training and Development, Mr. Dixon Nukudansu, emphasized the importance of high ethical standards.
The meeting also addressed challenges faced by the Corporate Affairs Directorate and outlined strategies for improvement. Officials also discussed ways to optimize NHI's Pulpit initiative, which aims to improve public awareness of the scheme and enhance member experience at service delivery points.
The NHIA has made a groundbreaking shift to a fully electronic claims processing system, improving efficiency and reducing delays for healthcare providers.
If we start from the onset of the NHIS, most of the claim submissions have been manual. So back in the day, when we are doing manual submissions, facilities have to travel long distances, carry their claims. If it's, say, 7,000 in volume, they have to carry 7,000 claims, bundle them, and then bring them. And when they come to the CPCs, we also have to now count. Initially, the vetting was done at the district offices and then consolidated to the Claims Directorate 2009. The CPCs were set up so that it's easier for the providers to go to the various CPCs based on where they are located. Like Accra, we are doing Volta, Eastern, Greater Accra, Oti, so that it's easier for them to come to Accra back then. So if there is manual claims, they have to bring all these manual submissions. So over the period since 2013, the electronic claims processing was initiated. But as of 2022, we were about 60%. Between 2023 and the end of 2024, we are like 99 point something. We don't usually want to say 100 because we do appreciate that there might be that one-off instance where someone has to do manual submission. So I'll say going electronic is one of the things that we have done, and that makes it easier. They don't have to carry the volume, they save paper, save transportation. They just at the click of a button, that happens.
The introduction of the Claims IT Android app is a game changer, allowing remote healthcare providers to submit claims without traveling long distances. The paperless claim approval process now ensures quick verification and payment approvals, further streamlining NHI operations. NHI assures members that these digital advancements will enhance service delivery, making healthcare access more seamless and reliable.
Last year, we rolled out an Android version of the Claim IT app, where Android means that for the CHIPS compounds and the Tier 3 facilities like maternity home health centers, those ones located in very remote areas, initially they would have to go to, say, the district health directorate, and one officer sits there and helps them key in their claims. But now if they have a tablet, they can actually go and look for reception wherever. I'm laughing because sometimes they'll say, we don't have reception, you have to go and stand on top of a rock or climb a tree. So if you have a tablet, you can climb a tree with your tablet as opposed to climbing a tree with your whole PC or a laptop. So we rolled out an Android version of the Claim IT app. That makes it easy for them to submit, and most of them are doing that. So you realize that at the end of January, if I go in February, you get some of the CHIPS compounds, they've submitted their claims. We vetted, we've moved, approved for payment. So it makes it very fast.
The National Health Insurance Authority in the Central Region is intensifying efforts to achieve its 2025 targets. At the 2024 Annual Performance Review meeting, staff from the regional office and districts outlined key strategies aimed at improving operational efficiency and expanding membership.
Despite significant growth with over 1.4 million active members, the region fell short of its 50% population coverage goal. Officials say increased public education, monitoring and logistics support are key to closing the gap. The NHIA is also integrating the NHIS number with the Ghana card to streamline services, ensuring easy access to healthcare for all members.
And finally, as part of efforts to educate the public on health insurance, the NHI is introducing Question of the Day, a daily interactive segment designed to address pressing NHIS-related concerns. Starting today, members can expect informative answers on coverage, registration, and claim processing. Stay tuned on NHI's official platforms for daily updates and insights to keep you informed and empowered about your health care benefits.
Hey, Swagger, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please, I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you son line,
Ina, look at you. What are you going to do in your office when you can just download the app to register for an NHIS membership?
Yes, my people, you heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
This is how we wrap up on this week's edition of NHIS in a Week. My name is Ifia Trema. But for more updates, you can kindly visit our website on www.nhis.gov.gh. You can also visit any of the social media platforms displayed on your screen. Thanks for watching.